Today, I want to put the spotlight on a culturally relevant, innovative solution in the water, sanitation, and hygiene, so-called WASH sector. Faro Foundation's water mission is focused on Hafir dams, which are the traditional Somaliland rectangular catchment basins, and our innovation is to lay a high-quality plastic geomembrane, which prevents the water from seeping into the ground. But there are other aspects to the WASH sector, and today I want to highlight something very different from what we do at the foundation in WASH. As you know by now, the idea of the podcast is to share how other organizations are innovating in development via different approaches in this safe space for discussion which Afri-CAN provides. So in this episode, what I really want to find out is two things. One, whether cultural relevance can be a primary driver from the word go in the development of WASH solutions in rural African settings. Number two, what unexpected cultural challenges WASH innovators have encountered. So today we're looking at innovation in the most basic sense, the introduction of something new into an existing cultural context. To enlighten us on this subject, I have invited Raissa Azzalini, who has worked for the public health humanitarian sector for more than 25 years, coordinating public health promotion responses in various contexts and countries. She started at Médecins Sans Frontières, and in 2010, Raissa joined Oxfam as search capacity for emergency responses before becoming a public health advisor in the global humanitarian team. She is passionate about community engagement and how program quality should be improved in the humanitarian responses and beyond. Since 2018, she is leading on the Oxfam Community Perception Tracker approach, which she will be telling us all about. Since last year, she's been working on menstrual hygiene management, leading to some research and innovation work on more sustainable, culturally appropriate, and environment-friendly solutions in fragile contexts. With her today, we have Zakarie Abdi, who is the public health practice technical team leader of the Oxfam Somali program based in Hargeisa. With over 10 years experience in community engagement, WASH, and public health practice, he is the lead of several projects, including the menstrual hygiene management solution REMI products, which is the innovation they are both going to tell us about today. So maybe Raissa, starting with you, could you please briefly describe the innovation that you're putting in the spotlight today?
Thanks a lot, Francesca, for having us today. Yes, we're quite excited to talk about what we call the REMI product as a kind of short name. So REMI is a social enterprise. They are based in New Zealand, and they have come up with this great product of period underwear. So high quality period underwear, I have to say, because and that's something they developed in Bangladesh. So you were talking about also how cultural aspects are quite important when we talk about products. They actually co-design it with some local manufacturers in Bangladesh to look at what would be the best product to support women and girls in that particular area where they were working. So they developed the period underwear rather than actually the sanitary pad that often we also see in this part of the in this sector, because some women were making comments as well of how sometimes when they walk it's actually moving, and I think period underwear was quite seen as a great progress. So they developed those. And they also developed two other items, which for me were quite a discovery, is the washing bag and the drying bag. And the reasons are really linked to the women's practices and also the cultural knowledge, taboo and stigma around washing period underwear. So that was a washing bag. So women would not have necessarily to touch blood with their hands because in some culture it's not appropriate. You have this really waterproof bag, you put your underwear, soap, and you can actually wash without touching the blood. And they also developed a drying bag, because also in some parts of the world, it's not appropriate to dry your underwear in front of your family or your in-laws or other people outside of your family. So it looks, if you look at the drying line, it just look like a rectangular basically, and you can't see anything else. So those products were developed, co-designed with the local manufacturer and tried in Bangladesh. So if you want to know more about it, you can definitely go into their website, avrani.org, and they have case studies and also all the evidence of that. Now, how that's being developed in Bangladesh translate into Somaliland today. So we have tried those different products in 3 different settings: high severity contexts in Mali, in Central African Republic, and in Somaliland, that we will talk about it today. And we didn't know if it was going to be appropriate. So definitely that's really interesting how we can come in a fragile context, having interaction with women and girls, and see how this innovative product will be accepted or not, and why, and understand the reasons behind.
And what you mean by fragile context is because you were doing this in refugee camps in particular, wasn't it?
Yeah.
Yeah.
So we're doing that in displacement camps, in refugee camps, or in places or in villages or in schools as well, but of affected communities, often for kind of different crises. Yes, absolutely.
Great. Thank you, Raissa. So sort of building on this this example, I think there are many innovations that fail once they're adapted to developing country contexts, because they haven't taken into account the specificities of these contexts. Could you share examples that you have experienced where you've seen such failures?
Yeah, it's always a challenge. It's not a given. Something that works very well somewhere might not work very well in this particular context. I mean, I think we all have some of the places where we thought about a great idea and trying to do it. I think for me, it's not necessarily a failure, but sometimes we are thinking we need to produce locally a product, and I think we do that a lot. In many of our programs, we try to work with local manufacturers. We try to work with women's groups, sometimes with even students. We try to develop maybe the reusable pads that often are done in cotton, etc. I think it's a really great way forward. But what we've noticed is that sometimes it doesn't necessarily fit into what women actually need. So the product is not really the high quality that we are expecting. It might be like irritable, leads to some infection. So there's a really need to actually have high quality products. So even though we are kind of torn between producing locally, make it available, maybe having some income generating activities, but at the same time not necessarily providing really high quality, might also be a problem. So I've seen that on that particular area, and I think that's why we were really exciting to try to use a really high quality product.
Great.
Absolutely.
Okay, and sort of again, building on this this concept, what as I said before, what I really want to understand is how you managed to adapt the innovations to the local cultural context. And when we first spoke, you said to me something that stayed with me, which is that you said it is all about listening to people. So could you perhaps tell us a bit about the community perception tracker that you developed at Oxfam for this particular purpose? And thinking about what are the features of the ideal culturally relevant innovative product for you?
Yeah, I think we're struggling sometimes to listen to, or to take the time to listen to, but then it does pay off. So I think we try with the community perception tracker, we try to encourage the team, not necessarily to extract information in the way that we have like questionnaires with a lot of leading questions. So providing the space of having an engagement with different people in the communities that we work with, without necessarily directing and actually saying, actually, I know what your problem is. Please, could you write to me an answer? So I think that's the thing that we're trying to do with the community perception tracker, listening to the different women's and girls, especially on that project. And I think that Zakarie, you can also chip in because you have done that experience. You have done all this engagement. I think that's absolutely needed, and it goes both ways. We're coming with a new project. We want to also discuss around what the women are experiencing as challenges, and we need to check and double check that actually this project will probably respond to some of the challenges that women and girls are facing in that particular context. So we're not offering something that actually doesn't really match. So that dialogue, that's two-way dialogue that we call, it's absolutely important, and that definitely has been the base of this also pilot project. And I think the results were quite clear. We had more than 80% of the women in Somaliland saying that that project has really helped them in their daily life, in improving their hygiene, in their confidence as well, in being able to do different things during the day, going out, etc. So we see that it's almost building the trust that we have with communities, and we're coming with a really, really strong product, but something that really addresses some of the issues.
Excellent. Would you mind telling us a tiny bit more about, I mean, you said the whole point is that the information is not extracted per se, but how do you do the sort of the tracking? Just a little bit more detail on how it works, perhaps.
Yeah, sure. So basically, we use modern technology. We use a mobile phone or tablet. So when any of our team members are having interaction with communities, and sometimes it's about I don't know, education sessions or about a certain aspect of the project, there is interaction. There's a place where we meet, and it can be an individual, at the household, or it could be in groups. And we have those conversations. I think now it's for the person listening to kind of think, oh, that is an interesting point. That is a perception. That is maybe a concern, a question, something that people are feeling about. And I think I should be actually taking this. So we ask consent to just record that on a mobile phone, and the information goes into a database that we can then look at, and then we can do the analysis of all those perceptions. We use this extensively in disease outbreak like Ebola, cholera, COVID-19, to really understand beyond just the obvious, what is it that really affects people. I mean, COVID-19, for example, there was a lot of issues around gender-based violence, around issues on livelihood, on education. So it was not just only about the disease, even though there was a lot of questions around that, but it was not only that. So I think that's the other aspect that we'd like to capture. And that also helps us to update the context. Our analysis of the context evolve. Things are evolving. So I think with this particular project on MHM, so the menstrual hygiene management, we're very pleased because we have decided after the project is finished that we are going back to the same women a year after to also understand what happens, not just during the project, but a year later. Is it still a very relevant project or not? Or did things have changed or not in the way that women are using this project, and what will come next? Because that was the big question coming from women is, this is amazing product. Where can we get it? So we still have a lot of work to be doing.
Fascinating. Zakarie, I'm quite curious, going back to the specifics of the REMI products that you implemented. What would you say were the expected and also the unexpected cultural challenges that you encountered in implementing REMI products in Somaliland in particular? And my second question to you is, how important do you think it is to have a man champion an innovation like this?
Thank you so much, Francesca, for having me. I feel
Yeah.
honored. Oxfam Somali program has been doing MHM programming as a part of inclusive work since 2018. to address the diverse needs of women and communities during emergencies and crisis. So having implemented this new REMI product, which have added new components such as a drying bag and washing bag, has been innovative, and women has provided very positive, around 80% that they could take more social activities, etc. In our project, we have planned to include men as a part of discussion because there is economic aspect. They need to be more supportive on their families, members, wives, sisters, daughters when it comes to access to the materials and buy. So we have planned this project. Unfortunately, it has been a challenge to involve men in Somaliland context because it's very challenging to discuss these issues with male, especially when it is an IDP communities with low literacy rate. So that has been challenging, and we have tried to adapt that, and we have said let's start our office, our staff, and we have done for the first time the celebration of MHM Day on 28th of May last year, where male and female participated in our Oxfam staff office. So that has been achieved, and I think that will be the starting point. Yeah, I think personally I believe male should be part of this discussion because we are somehow related, and many families, the man is the head of household, is accessing the resources, and he should be supporting. So I think that's a very important part to be part of this discussion.
Thank you, Zakarie. So I guess my last question to both of you, really, I'd love to hear what both your viewpoints are on the sort of general discussion of the question of, is it okay to push cultural boundaries in the name of innovation or not, and why? Yeah, maybe do you want to kick it off, Zakarie? Give us your answer.
Yes, yeah. Actually, cultural taboos are really a big problem, and I think pushing boundaries as a part of innovation is really a good thing. Yeah, and I think that's what we are doing in our WASH programming, considering diverse contexts and addressing the stigma and cultural and boundaries and problems.
Great. Raissa?
Yes, I absolutely agree with that, Zakarie. Absolutely. I think he also gave an example how we faced that challenge in Somaliland around how we engage with men and boys, but how we kind of get something started. It's a beginning of a journey. The journey will be long. Just to say that in the other two countries, we were a little bit more lucky. So we did engage with men. We did some workshop, and the feedback were extremely positive. So we are going to continue on that route and then kind of make it more systematic that we engage with men and boys. Yeah, they came, they were really engaging, really reflecting as well on their role into menstrual hygiene and health, for their, as Zakarie said, for their wife, but also daughters and sisters and mothers, and to kind of normalize some of the conversation that we're having. So absolutely, pushing boundaries is absolutely important, and I think that's what we were trying to do with this project. I would say, as long as it's done in a very respectful manner, what we're trying to do here is providing really high quality product, but the idea is really to support women and girls, and it's not just about health, it's also about dignity. Yeah, in a way, it's also about rights, so we can push things further down the line, as long as everybody understands that. I think the other aspect really important is not just about the product, it's everything around it. So we talked about engaging, so all the conversation, and Zakarie and his team were having the conversation, presenting the project to the local authorities and different groups in the communities, leaders, to really ensuring that everybody's accepting this project. So that's really important. And also the aspect around it. When we talk about menstrual hygiene and health, we're talking about the projects we're talking about today. You mentioned things around and wash. So what we're doing is also looking at sanitation infrastructure, and often it's around toilets, it's around bathing areas that we also provide. So water supply, which is really important as well. So that's the enabling environment, but it's also about access to information. So it's how we are going to give access and provide access to girls at schools for them not to be a discovery when they first time have their periods and be a trauma. Access to information for women as well, understanding more the menstrual cycles and why women might feel different or in pain. So it's understanding all of that. It's making sure that this information is also accessible. Some men were telling us in Mali and in Car that, well, actually, they don't really have this information because that information might be only provided at secondary school, for example, and not everybody is going to secondary school. So is that also linking up with education? So I think you don't see it as an isolated project or an isolated project, but it's definitely a project that links up with many various aspects of life of women and girls. So pushing, innovating, pushing some cultural boundaries in that respect, I think it's absolutely detrimental.
Absolutely fascinating. Yeah. And I guess what you're mentioning in this last bit is the sort of aftermath of the actual Rimi product itself, right? And it's like creating a sort of cycle around that process that goes beyond the actual distribution of this, that's key as well, and requires, as you said, engagement with the community, the authorities, and kind of, yes, making an innovation sort of turn into something more systemic to an extent.
So definitely, and more learning. And we are going back to Somaliland, to those women and girls that were part of our project to really understand how things are going a year later. So definitely more to hear about. We have the few women reported issues of sizing. Remy has developed a Remy stretch. We call it Remy stretch, but it's 2 universal sizes. So instead of having 8, it's only 2.
Yes.
And Zakarie and his team has agreed to do a piloting on that as well. So we are going to go back to the women with we received the project a year ago, but we're also going to trial this universal size. And yeah, I think that's going to be an amazing thing. And we are at the moment working as well with Gaza and Lebanon. I think, so it's, yeah.
Yeah. And I think, you can also mention that Oxfam is working on some guidelines and some documents to guide in WASH programming, especially MHM, how to do it, education, and knowledge.
Yes, that needs to be done definitely as well, right? I mean,
absolutely. Well, that's my big learning was there was 2 aspects. One was about research because on innovation and research, you the teams are not necessarily trained; they're not researchers. So how to do operational research in a place where you're not necessarily trained. So that was one thing because we worked with some researchers from Munich University. So that was one. And then the second one was, how much our guidance is really dated and we need to update. Absolutely. But again, we need to update from that experience from the field, which for me then is really valuable because it's not me sitting in my room or in my office writing a guidance, but it's actually the experience of Zakarie and his team and Sana and his team and Piniel and his team to actually say, this is what we've done, this is how it works. And that could be part of the guidance. So that's definitely something big work, a lot of work for us now. Lots of good work.
Yeah.
No, but amazing what you've done, and especially to have you on board with this, Zakarie, is critical, as you said. I think this is hugely important, and I really admire you for doing this.
Thank you so much. Thank you so much. Yes.
There'll be some changes, I'm sure. We'll do a fantastic global Global Day this year, but a small step at a time. And it's true, Mali and Carl, yeah, it was absolutely amazing. I think it was even the discovery for the team. They were surprised themselves because some of the men decided to come back for the second round of workshop. And then Penny was like, but you've been there before. Yeah, but we wanted to go back because we have more to discuss about. And I was like, okay.
Oh my
that's fine."
goodness.
Yeah, and it was really nice to see. So we have a few testimonies as well from men in different
Extraordinary.
place. And I guess it's the same thing as a CPT. Is when you provide that space, so
Yes.
you realize
Yeah.
actually. So I think sometimes we have a pre-concept. We decide that no, this is not going to work. So for the imaging project, I'm telling you, I've went to so many hurdles. And now in Lebanon, some of people in the team are saying, well, actually, I don't think this is going to be working. And I'm like, we have already 1,000 of those products distributed in Gaza. Women like it so much that the feedback was so impressive that even the team was overwhelmed that they could not believe their eyes. And now we are distributing another 4,000. And then they want to have more. And I was like, well, maybe I know we there's a lot of things around the cultural aspect, but sometimes we decide for.
Yeah.
And I was like,
Absolutely.
I was telling everybody, even the Lebanese, my colleague Lebanese and my colleagues from Gaza and then from Jerusalem, say, actually, you know what? Let the women decide.
Exactly. That's the point.
Let them decide. Let them tell us what they like, what they don't like, and let's go back to our drawing board and then say, okay, maybe we need to do something different. But let them tell us what is it that they want and what is it that they like. And and the team wants to have it. It's like, I mean, it's a project I'm using myself, so I feel really confident to go around the world. I was in South Sudan hanging my things, and people were like, "What are you doing?" It's like, "Oh, this is my period underwear," like asking me, and then we had that conversation going. But for me, it's really crucial. It's choice, and I think we're realizing now within Oxfam that it's not just about one product. So when we have an emergency, we say, let's give some projects. So often say, so what do women use? Okay, that's what we're going to distribute. It's fine. Maybe the first hours, days, or weeks after an earthquake, it's what women will need.
Yeah.
But as time develops, maybe that's not what they want. And maybe the brand that you're using, Francesca, is different than my brand. And maybe I'm not like the same things that you'd like. And this is where you have lots of different products. So we should have those choices.
Exactly. That's the number
So-
one thing. Totally. Yeah.
Yeah.
Anyway, we'll try.
Yes.
But you know Zakarie knows Faro Foundation.
Yes, I heard. So which school did you go to?
There is a secondary school in Somaliland. It's like
Sheikh.
yeah, Sheikh. Yeah.
Were you at Sheikh?
Yes.
Oh my goodness. Wow. Amazing. It's like our major, it's the secondary school we have
Yeah.
there, which is huge, a very prestigious school.
Yeah. It's called the Eton College in Somaliland.
Yeah, that's it.
So by the time I went, Faro was not managing because I think they were
Yes,
managing.
it was before. It was SOS. Yeah,
SOS Herman.
Yeah.
SOS was managing. Yeah, and then Faro took over.
Yes,
Yeah.
exactly. Oh
Yeah,
my
so-
goodness.
So that's why I said, oh, Faro, they're managing with school. So
It's really it's a very interesting place.
Yeah.
Mm.
And going back to the project that we are talking about, I think in Oxfam Somali program, in every WASH project that we do, we add MHM, but usually it's like distribution. I remember 2018, we distributed more than 7,000. And I think from there, last year we distributed around 800 in other projects. But it's usually disposable bodies. But the other drying bag and washing bag is the other element is that Remy products. And also we provide underwear separately in our other standard MHM kit. And I think this one has inbuilt.
Exactly.
And that is also very unique. Yeah.
We need to think about sustainability as well. We need to think about
Yeah.
environment. So there's a lot of different aspects. That's why I really liked the Remy project when we had our first conversation some time ago, was that they really kind of trying to look at all those different aspects.
Mm.
Trying also to measure how much water you need actually in the lab. Trying to see you only need a small amount because everybody was saying, well, it won't have enough water. I was like, sure, again, and this time.
Yeah.
And they say it's absolutely fine. So I think there was a lot of things that we have, the preconception that we have to debunk to like, okay, let's try, let's see. And and then for me it's a project that goes beyond humanitarian. Absolutely. I mean, they can be
Yeah.
used in any context around the world.
Yes.
It's one of them. It's not only this one, but I think again, where we can have more access, more potential different projects, but also because for us, it means, as Zakarie said, if you do a distribution of disposal pads, you have to go back again and do it another one. Otherwise, you let
It-
women down.
It's not this. It's reusable pads that we
Yeah.
distribute. It's reusable pads, and I think regarding education, like we like in Somaliland is a Muslim society, so there is a lot of education aspect which is usually preached in, but male to male discussions, it happens. For example, it's Ramadan, fasting is accepted to women when they are having menstruation, prayers are exempted, there is no like intimate relationship, etc. So there is a lot of teaching within it, but I think one way to start is even engaging local Islamic imams, so they can engage discussion with male, and then they could be more supportive to women and in that aspect. Yeah.
That's quite true, yeah. Guys, thank you so much. It was fantastic to have you both, really.
Well, thanks so much. We'll keep in touch. We'll let you know when we have videos and something to share, because that's also something we will definitely share.